The United States and the Philippines have said they're considering new coronavirus restrictions on travellers from China after Beijing announced it would reopen its borders next month.
Xi Jinping has called for urgent measures to protect lives as China reopens. This after China continues to witness a massive surge in COVID cases.
Now, just when China was relaxing its travel restrictions, other countries are now imposing curbs. The United States has become the latest country to impose a mandatory COVID test.
Hello guys, and welcome to my channel. In this video we are talking about COVID in China. US imposes COVID testing for visitors from China. But before we continue our video, make sure to subscribe to our channel and hit the bell icon for more. The United States will impose mandatory COVID-19 tests on travelers from China, U.S. health officials said on Wednesday, joining India, Italy, Japan, and Taiwan in taking new measures after Beijing's decision to lift stringent zero-COVID policies. The officials told reporters that beginning on January 5, all air passengers 2 years old and older will require a negative result from a test no more than 2 days before departure from China, Hong Kong, or Macau. Passengers who test positive more than 10 days before a flight can provide documentation of recovery in lieu of the negative test result, the federal officials said. They attributed the change in policy to the lack of information on variants of the SARS-CoV-2 virus and concerns that the increased number of COVID cases in China could result in the development of new variants of the virus. The United States also is expanding its voluntary genomic sequencing program at airports, adding Seattle and Los Angeles to the program. That brings the total number of airports gathering information from positive tests to 7. Chinese state media said COVID-19 testing requirements imposed by several places around the world in response to a surging wave of infections were discriminatory, in the clearest pushback yet against restrictions that are slowing down its reopening. Having kept its borders all but shut for 3 years, imposing a strict regime of lockdowns and relentless testing, China abruptly reversed course toward living with the virus on December 7, and a wave of infections erupted across the country. The real intention is to sabotage China's 3 years of COVID-19 control efforts and attack the country's system. State-run tabloid Global Times said in an article late on Thursday, calling the restrictions unfounded and discriminatory. Global spending by Chinese visitors was worth more than $250 billion a year before the pandemic. The United States have raised concerns about potential mutations of the virus as it sweeps through the world's most populous country, as well as over China's data transparency. The U.S. Center for Disease Control and Prevention is considering sampling wastewater from international aircraft to track any emerging new variants, the agency told Reuters. China, a country of 1.4 billion people, reported one new COVID death for Thursday, same as the day before. Numbers which do not match the experience of other countries after they reopened. China's official death toll of 5,247 since the pandemic began compares with more than 1 million deaths in the United States. Chinese-ruled Hong Kong, a city of 7.4 million, has reported more than 11,000 deaths. UK-based health data firm Airfinity said on Thursday around 9,000 people in China are probably dying each day from COVID. Cumulative deaths in China since December 1 have likely reached 100,000, with infections totaling 18.6 million, it said. Airfinity expects China's COVID infections to reach their first peak on January 13, with 3.7 million cases a day. Excess mortality. China's chief epidemiologist Wu Zunyu said on Thursday that a team at the Chinese Center for Disease Control and Prevention plans to assess fatalities differently. The team will measure the difference between the number of deaths in the current wave of infections and the number of deaths expected had the epidemic never happened. By calculating the excess mortality, China will be able to work out what could have been potentially underestimated, Wu said. China has said it only counts deaths of COVID patients caused by pneumonia and respiratory failure as COVID-related. The lifting of restrictions, after widespread protests against them in November, has overwhelmed hospitals and funeral homes across the country, with scenes of people on intravenous drips by the roadside and lines of hearses outside crematoria fueling public concern. Economic woes. The world's second-largest economy is expected to slow down further in the near term as factory workers and shoppers fall ill. Some economists predict a strong bounce back from a low base next year, but concerns linger that some of the damage made by 3 years of restrictions could be long-term. Consumers may need time to recover their confidence and spending appetite after losing income during lockdowns, while the private sector may have used its expansion funds to cover losses incurred due to the restrictions. Heavily indebted China will also face slowing demand in its main export markets, while its massive property sector is licking its wounds after a series of defaults. China's factory activity most likely cooled in December as rising infections began to affect production lines. That's all for today's video. Hope you guys enjoyed our video. For more videos, make sure to subscribe to the channel and hit the bell icon for more interesting videos. Thanks for watching and have a wonderful day.